You are on the front lines of battling the COVID pandemic. Why is this less of a threat?
Well, for several reasons, but I'm really glad that they're starting to molecularly test the patients. This is really important. It's only through seeing the virus through actual testing rather than waiting for symptoms that you can really understand what's going on. We know that people on the ship are at risk, and I remind people, both the crew and the passengers, and we owe them also testing. But we know that the US and others around the world have done a great job with containment. It is less easy to infect others, we believe, based on the data we've had to date with hantaviruses. And so there's not a threat to the general American public, but there is a threat to the people who got off the ship, to the people who are still on the ship, and to the people and to the crew.
This morning, we learned that a French woman who was a passenger on the ship has become the 7th confirmed case. Do you think we'll see more positive test results pop up in the coming days or weeks?
Well, as you know, the test positives are 5 to 15 days before you develop symptoms. And so that's why we should be doing molecular tests. We shouldn't be waiting for symptoms. We learned that in COVID, during the Trump administration, we were doing 2.5 million tests a day, molecular tests. We really know how to do this, and the ship should take on one of those testing machines. They're much smaller. They can test everybody on the ship. They can test everybody who got off the ship so that people can be reassured. If you're test negative, you don't have hantavirus. If you're test positive, you do have hantavirus and should be able to take the right supportive care.
Is this hantavirus behaving as the experts would predict?
Very good question, Wolf. So there's actually 2 different main strains of hantaviruses. The one in North and South America really causes more pulmonary symptoms, and the ones in Asia causes more renal symptoms. The one in Asia, the South Koreans do have an effective vaccine. They use it in their South Korean military, where they have much more exposure to mice and rodents. And so there is a way to, in the long term, develop both probably treatment as well as a vaccine. But this particular hantavirus strain is very similar to the hantavirus strain that we have in the United States, except that we've been able to show human-to-human transmission with this Andes strain.
Do you have any concerns, Dr. Birx, that this virus could mutate and become more easily transmitted from person to person?
That's always a concern with an RNA virus. In other words, these viruses' sole goal in life is to become more adapted to more hosts because they can't live at all without a host. In the most cases, it's the deer rat and the deer mice in the United States, and that's why it's so severe in the Four Corners area. And that's why it's really important to test people and to molecularly test people so that you can really follow this virus over time. We really do need to stop following viruses by symptoms and follow viruses by tests.
Have you been satisfied with the response that you've seen both by the World Health Organization and the U.S. evacuation that has placed the 17 Americans in quarantine in Nebraska right now?
It was totally the right thing to do from this administration's standpoint, because we needed to test these patients. What I'm disappointed by is as soon as the first case appeared and we had that death, there should have been testing brought on board. We learned that from the Diamond Princess in 2020. You need to bring tests on board to really test the crew and passengers so you can reassure them these are the individuals who are test positive and these are the individuals that are testing negative. And then you'll learn a lot more about transmission. You'll shorten that incubation period, which I'm sure it's too long, but it's based on subjective analysis of symptoms. And so we really need, as a global coalition, to support these passenger ships and really support the crew and the passengers with 21st century testing.
The risk to the general public remains very low, and that's because because we're not dealing with a new virus here. We've known about Hantavirus for decades. Generally, the strain in the US is not spread person to person. The strain, the Andes virus, the Andes strain that is implicated in this case of the cruise ship, can be spread person to person, but it requires prolonged close contact. And right now, these passengers from the cruise ship are being carefully monitored. They are being tested. Their symptoms are being monitored. If they are to be released back to their home communities, their whereabouts will be known. Local public health officials will be following them, and any contacts will be identified as well, therefore stopping the transmission. So I do not believe that we're going to see much further spread. We may see a few more cases, but it seems very likely that these sets of hantavirus cases will be contained as hantavirus has been before.
And you mentioned that we've known about hantavirus for a while, and a lot of what's talked about is sort of that virus reproductive number, meaning how many people an infected person typically infects. This is much lower than COVID-19, right?
That's exactly right. So with COVID, with measles, with flu, we're talking about something that's very highly contagious that you can get even from breathing the same air as someone or from being in close proximity for a short period of time. Based on what we've known in the past with this strain of hantavirus, it requires prolonged close contact. So living with someone, sharing drinks, or being with someone for long periods of time, not just being in the same general vicinity of that person.
And, you mentioned some of those other diseases and viruses as well. Obviously, most recently, we've seen outbreaks of measles on a serious level here in the United States. But I wonder, are you seeing lessons, at least at this point in what we know in hantavirus, are you seeing lessons learned or applied from the COVID-19 pandemic, not just in terms of public health, but also in communicating with the public as well?
Well, I think one lesson that we learned from COVID is that you have to communicate what you know when you know it in a transparent way, and that you also have to communicate what you don't know and what you're following. I think in this case, the World Health Organization has been very good in this regard. They have had to coordinate what's been happening around the world, this global response. We have passengers from more than 20 countries who are now going back to their home countries. All that needs to be coordinated, the testing, the subsequent follow-up, the number of cases that emerge, that all needs to be communicated in a way that reassures the public and lets people know what to expect. I do worry about what's happening here in the US. We know that there are thousands of workers in the Centers for Disease Control and Prevention who no longer work there, including many people involved in outbreak response. We know that the US is no longer a part of the World Health Organization, and so there might be less coordination and less efficient coordination as there used to be before. And we have not gotten as timely of information here in the US as we may have expected in the past. And so I hope this is a call to action for us to really prioritize public health, prevention of public health, and monitoring. Look, I don't think that hantavirus this time is going to be the virus that the general public has anything to worry about. But there may be another virus in the future that we have to worry about. And I do worry that we have not learned appropriately the lessons from COVID, including communication, but also the importance of investing in local public health, because right now, as these individuals are returning back to their home communities, it is the health workers on the ground who are doing the outreach, who are doing the contact tracing, who are helping to keep communities safe.
And that's part of what I was going to ask you, because, look, we heard from the acting CDC chief saying this isn't COVID. I've heard that from you as well in terms of transmissibility and what we know right now. But I wonder, moving forward, what are you looking for? What is going to be the most critical portion of managing hantavirus here in the United States? And obviously, it's contained at these facilities as far as we know right now. But what will be most important moving forward?
Well, we need to see how many more cases are going to come. And there may well be more cases that arise because now these are individuals who are being tested. They are in facilities where they can get that treatment. And also we know the incubation period is long. The time between exposure and symptoms can be as long as 8 weeks. And so people can start testing positive. The question then becomes, are we going to see cases of asymptomatic transmission? Right now, we believe that transmission only is occurring when people are symptomatic. So we do not believe that there's is asymptomatic transmission. If there is, that would change things. Also, it might change things too if we see cases in people who do not have a direct connection with that cruise ship. For example, if there are passengers on board the flights, but who are not on the cruise ships, or family members, if they start testing positive. None of that has happened, but I think that requires careful monitoring, and again underscores why that public health response is so important.
The head of NIH, who is also the CDC director currently, was out and about and talking to whomever really he could speak with, it seems, to try to calm the fears that have spread around this virus, making the point to press and say, this is not the pandemic all over again. And you've been an important voice in this as well. Help people understand what kind of threat this actually poses and what kind it does not.
So hantavirus is a deadly infectious disease with a high mortality rate. But the thing is, it's not a very communicable infectious disease. It's something that there are kind of tried and true public health principles that can contain it. And we've been able to contain it in the past, and it's behaving exactly as we would expect the Andes version of hantavirus to behave. And I think that should be reassuring that, yes, this is a public health emergency. Yes, we have to deal with what's happened on that ship and all of those individuals, those passengers that are now going to go through this incubation period. Some of them are going to test positive, but there hasn't been any secondary cases outside of that ship, and there are plans in place to deal with that if it were to occur. So I'm pretty confident that this is something that is something that's going to be handled well. And remember, not every public health emergency rises to the level of an epidemic or pandemic threat.
Yeah, and that, which is an important piece of this, of course, an important part of the fear here. There could be more positive cases that could pop up still, of course. What's important to understand if that inevitably does occur?
This is expected. That's why we're going through all of this. That's why these 17 Americans are being evaluated at the National Quarantine Center. They're being tested, they're being checked for symptoms, and they're going to go through a 6-week period, just like the other Americans that disembarked earlier. But we do expect some may test positive. But because they're under monitoring, they will be promptly intervened upon with tests, with isolation, and with treatment to limit secondary spread. So that's the whole concept of operations. That's what we're referring to when we talk about this not posing a threat to the general public, because number one, it's not very communicable. Number two, there are multiple layers in place with public health to try and minimize any impact on the general population. It's important that public health is well resourced. It can do all of this, but it is something that they can do. And they did after the Ebola outbreaks in 2014, when all of those nurses and doctors came back from Western Africa and were working in Doctors Without Borders. And they were monitored very similarly with a more higher consequence disease without any untoward effects. So I think we can do this.
This seems to, and you're kind of getting at this, to reflect a kind of post-COVID anxiety, where kind of any unusual virus, something that people are not, it's not a household name in terms of a virus, if you will, immediately sets off alarm bells. Is that an understandable kind of overcorrection, doctor, or is it a dangerous one?
It's understandable. COVID was a very traumatic event for many people. This was the first time that they'd been through a pandemic. It disrupted their entire way of life. So now everything is looked through a pandemic lens. Anytime there's an infectious disease emergency, whether it's Mpox, whether it's bird flu, whether it's hantavirus, they're looking at it through that lens of COVID. That's coloring everything they think about, and that's what they're worried about. But you have to remember that not all viruses are interchangeable, that each has distinct biology, distinct transmission, and that's going to reflect the risk that it poses. So not everything can spread like COVID or influenza. Not everything can spread like Ebola even. So it's really important to keep that in mind, that everything is going to be tailored to the actual pathogen's biology. And I think that sometimes that's lost on people. After 1918, they called that the forgotten pandemic. COVID-19 is a little bit opposite of that because it's really triggering people, understandably so.